The purpose of writing my book, The Oxygen Revolution, with Virginia McCullough, was to encourage people to get this therapy, because there was so much misunderstanding in the medical community that's delayed the acceptance of this, or I should say, has so biased the understanding of this that it's prohibited people from getting this therapy. And I give the example of the application of this to acute severe traumatic brain injury. There are multiple randomized trials that have been done up to 1992, but now even more, showing that within days after an acute severe traumatic brain injury, and I'm talking so severe, comatose, on a ventilator, that just a few treatments can reduce the death rate by 50 to 60%. And this is reproducible. It's been shown in multiple studies. And yet, despite this phenomenal effect on saving lives, we are not using it. Currently, there is a study going on, yet another study in the United States, in multiple hospitals, applying hyperbaric oxygen therapy for acute severe traumatic brain injury. And there's a control group in there that doesn't get any hyperbaric oxygen. I don't know how you can do a study like that when already there are multiple studies showing that this can reduce the mortality. And my point of putting it in the book is that science, I used to think, was so pure, and medicine, that applying the science, which is called evidence-based medicine, was a straightforward process. In fact, it's not. It's affected by personal issues, doctors, their personalities, their beliefs, politics, reimbursement, just a whole host of things. And here we are with this evidence showing that this is probably the therapy having the greatest effect on reduction in mortality of any therapy ever in medicine. Maybe some antibiotics. But for something delivered in an emergency setting, there's nothing that comes close to it. And the evidence shows that, but we're not using it. What I said was that we can't trust the medical profession to make proper decisions for us on our medical care, that you have to go out and do your own research and find the evidence that's out there for best treatment of your condition. You have to be, as Tony Robbins said, the CEO of your medical care.